When discussing health and high blood sugar, many people immediately think of diabetes. Diabetes is a chronic condition characterized by elevated blood sugar levels due to problems with insulin production or action. This condition can be extremely dangerous and even deadly if not managed properly. According to the World Health Organization, diabetes is a leading cause of death globally. Type 1 diabetes, often diagnosed in childhood, results from an autoimmune reaction that destroys insulin-producing cells in the pancreas. Type 2 diabetes, which is more common, typically develops in adulthood and is often linked to lifestyle factors such as obesity and inactivity. Long before individuals receive a diabetes diagnosis, the body often sends out warning signs indicating that blood sugar levels are elevated. These signs can manifest in various ways and may be subtle, making them easy to overlook. Ignoring these early warning signals can lead to serious complications, including cardiovascular diseases, nerve damage, kidney failure, and vision problems. Understanding these signs is critical not only for individuals with a family history of diabetes but also for anyone concerned about their health. In today's world, where many diets consist of artificial and processed foods, the number of people experiencing high blood sugar is dramatically increasing. Processed foods, often laden with refined sugars and unhealthy fats, contribute to insulin resistance. The rise of fast food culture, combined with a sedentary lifestyle, has made it easier for individuals to gain weight, leading to a higher risk of developing type 2 diabetes. Furthermore, stress and lack of sleep can also elevate blood sugar levels, creating a vicious cycle that affects overall health. Understanding blood sugar and its impact. Blood sugar, or glucose, is the primary source of energy for our bodies, derived mainly from carbohydrates in our diet. When we consume carbohydrates, they are broken down into glucose, which enters the bloodstream. After eating, blood sugar levels rise, prompting the pancreas to release insulin, a hormone that facilitates the uptake of glucose by cells for energy. In healthy individuals, this process occurs seamlessly. However, in those with insulin resistance or insufficient insulin production, glucose remains in the bloodstream, leading to hyperglycemia. High blood sugar can have severe consequences for health. Prolonged hyperglycemia can damage blood vessels, leading to cardiovascular diseases such as heart attacks and strokes. It can also cause damage to nerves, neuropathy, kidneys, nephropathy, and eyes, retinopathy. Over time, the body's organs can become compromised, leading to complications that may necessitate medical intervention, including dialysis or surgical procedures. The key to preventing complications from high blood sugar is to pay close attention to our bodies and recognize the signs they provide. Symptoms like excessive thirst, frequent urination, fatigue, and unexplained weight loss are often the body's way of signaling that something is off. By being aware of these signs, we can take proactive measures to maintain optimal health and potentially prevent serious conditions like diabetes. Regular health checkups, blood tests, and self-monitoring can empower individuals to take charge of their health. Keep watching to learn about the most important signs that indicate your blood sugar levels may be too high, as well as symptoms to watch for if you suspect you might have diabetes. Before we begin, don't forget to subscribe to our channel for daily tips and turn on notifications so you never miss our new videos. 16 signs your blood sugar is high. Excessive urination. If you find yourself urinating frequently, especially at night, it may be a sign of high blood sugar. This condition, known as polyuria, occurs when the kidneys filter excess glucose out of the blood and into the urine, drawing water along with it. As a result, individuals may experience an increase in urination frequency, leading to dehydration and fatigue. The constant need to urinate can also disrupt sleep, resulting in a cycle of exhaustion. Blurred vision. Temporary blurred vision can occur when high blood sugar causes the lens in your eyes to swell due to fluid shifts. This swelling affects the eye's ability to focus clearly, leading to visual disturbances. If blood sugar levels remain high for prolonged periods, it can lead to serious complications, such as diabetic retinopathy, where blood vessels in the retina become damaged, potentially leading to severe vision loss or blindness. Difficulty concentrating. When the body lacks insulin, it cannot effectively transport glucose from the bloodstream into the cells. This leads to fatigue and difficulty concentrating. The brain, which relies on glucose for energy, can become foggy and unable to function optimally. High blood sugar can also cause dehydration as the body tries to eliminate excess glucose, further impairing cognitive functions. Dry mouth. High glucose levels can lead to dry mouth by affecting both blood and saliva production. A dry mouth can create discomfort and increase the risk of dental problems, such as cavities and gum disease. Saliva plays a crucial role in oral health by helping to wash away food particles and bacteria, and its absence can lead to significant issues if not addressed. Impotence. This issue, primarily affecting men, can stem from long-term blood sugar control problems that damage nerves and blood vessels. Erectile dysfunction is a significant indicator of underlying health issues related to diabetes and may affect self-esteem and relationships. Addressing blood sugar levels through lifestyle changes and medical intervention can lead to improvements in sexual health and overall well-being. Recurrent infections. Watch for frequent infections, particularly in the urinary tract and skin. High blood sugar levels can weaken the immune system, making the body more susceptible to infections. Bacteria and fungi thrive in high glucose environments, leading to conditions such as urinary tract infections and skin infections. Individuals with diabetes often experience infections more frequently than those with stable blood sugar levels, making awareness and preventive care crucial. Slow healing wounds. If minor cuts and bruises take longer than usual to heal, high blood sugar could be the culprit. Elevated glucose levels can impair blood flow and nerve function, both of which are essential for effective wound healing. Poor circulation can lead to an increased risk of infections and complications, such as foot ulcers, which are particularly concerning for individuals with diabetes. Stomach problems. High blood sugar can delay the emptying of food from the stomach, leading to conditions like gastroparesis. Symptoms may include bloating, abdominal pain, nausea, or vomiting. This can significantly impact dietary habits and nutrition, making it challenging to manage blood sugar levels effectively. Gastroparesis can also complicate diabetes management, requiring careful monitoring of food intake and blood sugar levels. Constant fatigue. Chronic fatigue is a common symptom when blood sugar levels are consistently high. Low thyroid levels can contribute to fatigue, and the energy needed to fight infections may leave individuals feeling constantly tired. This persistent fatigue can affect one's ability to engage in daily activities, impacting overall quality of life. It's essential to identify the underlying causes of fatigue to determine the best course of action for improvement. Frequent thirst. High blood sugar levels cause the kidneys to work overtime, leading to increased fluid loss through urination. This makes you feel excessively thirsty, prompting you to drink more water. Known as polydipsia, this sensation is the body's way of trying to maintain hydration in response to fluid loss. However, this can become a frustrating cycle, as increased fluid intake may lead to more frequent urination. Dry and itchy skin. Poor blood circulation caused by high blood sugar can lead to dry, itchy skin, particularly on the lower legs. This symptom can be uncomfortable and may cause scratching, which can lead to infections. Maintaining proper hydration and skincare is essential for those experiencing this issue. Using moisturizing creams and staying hydrated can help alleviate some of the discomfort associated with dry skin. Increased hunger. A heightened appetite may stem from a lack of the hormone incretin, which regulates the flow of sugar from the liver after meals. If glucose is not effectively transported into cells, the body may signal hunger despite recent meals. This can lead to overeating and potentially contribute to weight gain, creating a cycle that complicates blood sugar management. Excess abdominal weight. Excess weight, particularly around the abdomen, is often a sign of insulin resistance. When the body struggles to convert food into energy effectively, it can lead to increased hunger and weight gain. Maintaining a healthy weight is crucial for reducing the risk of developing type 2 diabetes. Regular exercise and a balanced diet can play a significant role in achieving and maintaining a healthy weight. Nerve problems. Elevated blood sugar can damage the blood vessels that supply oxygen and nutrients to the nerves. This can result in peripheral neuropathy, characterized by numbness, tingling, or pain in the hands and feet. Neuropathy can be a painful and debilitating condition, significantly affecting quality of life. Early detection and management are essential to prevent further nerve damage and alleviate symptoms. Skin changes. Discoloration and growths on the skin, such as dark, thick patches known as acanthosis nigricans, may indicate high blood sugar levels. These changes often occur in areas like the neck, armpits, and groin. Skin changes can serve as important visual cues for monitoring blood sugar levels, and individuals should discuss any noticeable changes with a healthcare professional. Tingling and numbness. These sensations often accompany nerve damage caused by high blood sugar, a condition known as neuropathy. Tingling or numbness in the hands or feet can be distressing and may indicate the need for medical evaluation. Early intervention can help manage symptoms and prevent complications, emphasizing the importance of regular checkups and blood sugar monitoring. 8 symptoms of diabetes. Now that you're aware of the signs of high blood sugar, here are symptoms that may indicate diabetes: fatigue and hunger. When food is converted into glucose, the body requires insulin to transport this energy to cells. If cells resist insulin, energy is not delivered efficiently, leading to persistent fatigue and increased hunger. This cycle can contribute to overeating and weight gain, complicating diabetes management. Frequent urination. On average, a person urinates 4 to 7 times a day. With diabetes, elevated blood sugar forces the kidneys to work harder, leading to increased urination, known as polyuria. This can disrupt sleep and daily routines, leading to fatigue and irritability. Recognizing this symptom is crucial for early intervention and management. Weight loss. Frequent urination can lead to calorie loss, as the body expels excess glucose and water. Diabetes may also prevent sugar from reaching cells, contributing to unintended weight loss despite an increase in appetite. This unexpected weight loss can be alarming and should prompt a consultation with a healthcare provider. Dry mouth. Frequent urination leads to fluid loss, which can cause dehydration and a persistently dry mouth. This condition can affect oral health, as saliva is essential for preventing cavities and gum disease. Individuals experiencing dry mouth should ensure they stay adequately hydrated and maintain proper oral hygiene. Blurred vision. High blood sugar can pull fluids from tissues, including the eyes, causing blurred vision. If left untreated, diabetes can damage blood vessels in the retina, potentially leading to severe vision problems and even blindness. Regular eye exams are essential for individuals at risk for diabetes to monitor eye health and prevent complications. Slow healing cuts. High blood sugar can impede blood flow and nerve function, making it challenging for the body to heal wounds effectively. Slow healing cuts can become serious if infected, particularly in individuals with diabetes, highlighting the importance of proper wound care and monitoring. Tingling in hands and feet. Excess blood sugar can damage nerves, resulting in tingling or pain in the extremities. This neuropathy can be uncomfortable and may indicate more serious underlying issues, making early detection essential. Managing blood sugar levels can help prevent further nerve damage and alleviate symptoms. Dark patches of skin. The skin condition known as acanthosis nigricans creates dark patches, often in the neck or armpits, and can be associated with insulin resistance and diabetes. These changes should prompt a discussion with a healthcare professional, as they can signal underlying health issues that need to be addressed. The importance of early detection. According to the CDC, 30.3 million people in the US have diabetes, including 23.1 million diagnosed and 7.2 million undiagnosed. Additionally, 33.9% of the US population has prediabetes, a condition that increases the risk of developing type 2 diabetes. Recognizing the early symptoms of diabetes is crucial, as many can be mild and easily overlooked. For example, increased thirst and frequent urination may be dismissed as signs of aging or simply not drinking enough water. Ignoring these signs can lead to long-term damage and complications that could have been prevented with timely intervention. If you suspect you may be experiencing symptoms of high blood sugar or diabetes, it's essential to consult a healthcare professional. Early diagnosis and management can significantly improve health outcomes and quality of life. Regular screenings and maintaining a healthy lifestyle, including a balanced diet, regular physical activity, and stress management, are vital steps in preventing and managing diabetes. Conclusion. Being informed about the signs and symptoms of high blood sugar and diabetes is the first step toward proactive health management. By understanding these indicators, you can take control of your health and make informed decisions about your lifestyle and diet. Simple lifestyle changes, such as adopting a balanced diet rich in whole foods, increasing physical activity to at least 150 minutes a week, and regularly monitoring blood sugar levels, can make a significant difference in your overall health. Additionally, seeking support from healthcare professionals, nutritionists, or diabetes educators can provide valuable insights and strategies for managing blood sugar effectively. Community resources and support groups can also help individuals with diabetes feel less isolated and more empowered in their health journeys. Enjoyed this video? Hit the like button and share it with your friends. Subscribe to our channel for more videos like this. Thanks for watching.